Hello, I'm Dr. Roshmi Gupta, ophthalmic plastic surgeon at Bangalore. And today in this video, we are going to be talking about the treatment of ptosis in a child. A ptosis is a droopy eyelid, and in a child, it may be present since birth. The eye looks half closed. Well, what's the harm in that? One, it blocks the clear vision of the eye and doesn't let the development of the eye occur properly, which means the child may end up with a lazy eye or amblyopia, which has subnormal vision. And this cannot be corrected once the child grows older. It has to be corrected before the age of 7. We'll remember that while ptosis needs surgery, it can't be treated by surgery in isolation. We check if the child has any glass power and prescribe the glass power, and if indeed the ptotic eye is weaker than the other eye, we ask for occlusion, patching of the good eye, so that the amblyopic eye, the ptotic eye, exercises more, works more, and so develops its strength. So it's a combination of these therapies as well as surgery, and surgery becomes important when we see that the ptosis is indeed damaging the vision of the. Usually, if the ptosis is severe enough to block the pupil of the eye, the center of the eye, that means the muscles of the eye are not good. The eyelid muscles are weak. So we are going to take the help of the forehead muscles to do something called a sling surgery. We insert a silicone band from inside the forehead onto the eyelid so that as the eyebrows are lifted, the forehead muscles help to keep the eyelid open, and this is called a sling surgery. Supposing by my examination I find that the eyelid muscle has enough strength, in that case we go in through what is called a hidden incision, a concealed incision on the eyelid. We go in, find the muscle and tighten it to strengthen it so that it can do its job better and lift the eyelid up. All these surgeries are done under general anesthesia for a child. What we are doing is ultimately artificially helping the eyelid gain its, a good height. So we are not expecting an exact match with the other side. Yes, 8 out of 10 children will get exactly the same height as the other side. However, because it's not a complete natural cure, you are going to have a difference in the size of the eye when the child looks up or child looks down. In a small percentage of the patients, the eye will not close fully at night. In the initial weeks, we are going to give topical lubricants, tear substitutes, to make sure that the surface of the eye does not get dry. But most of the children, because they're children, they adapt very well to it. The eye will remain patched for maybe a day. For a week, the child will probably be on oral painkillers, etc. After a week, the stitches will either be taken out or they would have been starting to dissolve. In this situation, after 1 week, the child can bathe, wash the face, go out and play, and lead a completely normal life. There's no food restriction. In this video, we are going to be talking about the results of ptosis surgery. As we said, about 8 out of 10 kids reach exactly the same height as we planned. If it is a larger difference, particularly in a child, if it's obstructing the eyelid, then maybe a resurgery is required. And so far as the surgery mark is concerned, if the surgery is done through the brow, there are going to be 3 5mm tiny puncture marks which fade with time. If it is done through the eyelid, as in tightening of the muscle, it's done through a concealed incision on the eyelid crease. So it's really not going to be visible. I hope this allays some of your fears and worries about the ptosis in your child.